So what I want to do now is just do a quick drawing to show you a little bit more about what I mean, and then I'll have some time for your questions. So let's do this. So we have a stomach, let's say, right? So there's a stomach. And your stomach has a protective layer of mucus. Okay, like this. If this mucus is worn away, like in these examples here, okay, this is an unprotected area, and so that hydrochloric acid is going to penetrate areas that it doesn't belong. Now here you have the pyloric valve, and if this pyloric valve is not opening and closing properly, some of that acidic content can kind of back up into the esophagus, and that's called the acid reflux, right? Thank you, Vegas, I appreciate it. So all the omeprazole in the world is never going to patch up this problem here. This is the real cause of the problem, is this. That's the problem, all right? So what proton pump inhibitors do, or antacids do, is they're going to prevent the stomach from getting a very acidic pH. So the stomach wants to operate in an area of like 2.0 to 4.0 generally. Okay, that's very acidic. Your pH scale goes from 0 to 14. 7 is in the middle, that's neutral. This is where water is, okay? This is where blood is. This is where your urine should be. So different tissue, different substances should be different pHs. Your stomach is going to operate in a very acidic environment. So the more to the left we go, the more acidic. The more to the right we go, the more basic, aka alkaline. Okay, and by the way, you don't want to drink alkaline water either, you guys. You want to be drinking 7.0 water. If you're drinking 9.0 water, that's 100 times stronger than 7. For every point up on this scale is 10 times higher. Okay, so if you go from 7.0 to 8.0, that's 10 times higher. From 7.0 to 9.0, that's 100 times higher. Okay, 100 times more alkaline. And the converse is also true. So if I have 6 here, 5 here, the difference between 6 and 5 pH is 10 times more. The difference between 6 and 4 is 100 times more, and so on and so forth. So in this very magical acidity, okay, in this very magical acidity level in the stomach, switches are turned on to digest proteins, and they can only be turned on when that acidic environment is reached. Okay, and absorb minerals. Second switch turned on. Okay, so these are the two switches that are initiated in the proper pH range. So an antacid, meaning anti-acid, is not going to allow the stomach pH to reach here. It's going to maybe be lingering around 6 or 7 or who knows what. That is not going to allow this to occur. Okay? So this is why, yeah, don't drink it. You want your water to be 7.0. If you want to add alkalinity to it, do so in the form of actually adding lemon juice or something like that from a fresh squeezed organic lemon. You don't want to be drinking alkaline water. This is not what you want to be doing. So the problem here is medicine does not look at what's causing problems. They want to look at symptom relief. Okay? So if somebody has heartburn, in their mind they're thinking, let's cover up this symptom with a drug. Hey, problem solved. No, not at all. Robbing Peter to pay Paul, actually. Maybe this person's heartburn's going away, but now they're not going to digest protein. Now they're not going to absorb minerals.